What we've got to start doing in this country is incentivizing people to do what's going to actually make things better for all of us in our community, whether it's individual consumers, whether it's builders. But I believe that there can be a win-win situation. And with someone like President Obama, who is trying very hard to tackle a myriad of problems all at once, this is something that will happen eventually, and that's why I want to be in the Senate. I want to help make it happen.
Would you support and work for the continued viability of Medicare by reducing subsidies to Medicare Advantage programs and to allow Medicare to negotiate drug prices for all beneficiaries?
The simple answer to your question is yes. Would you support and work for the continued viability of Medicare? Yes. By reducing subsidies to the private section of Medicare? Yes, because the same services being provided, the care is not any better. It's just simply that we're providing corporate welfare for another layer of administration that's really not necessary. Would I allow the negotiation of prices by Medicare? Yes, very simply. I support President Obama's health care plan. He's calling for a public option, and many people are vacillating and wavering on it. This requires courage. I just spoke to you about Medicare. Medicare is already in existence. It is the best example we have of how a public option will work in this country.
Well, last week my wife and I went to Louisville Veterans Hospital down for throat cancer. They only have 2 doctors to see all the veterans that come to the Wade Park VA. I have Medicare also with the disadvantage program. That costs too much. But the VA, with the young girls and boys coming back all mangled up, besides the member and so forth, there's got to be senators that really believe in elected officials.
What you're talking about with the VA service is very real. And as a senator, I would be in a position to serve on committees, to actually hold hearings, and I'm a very good attorney in terms of asking those questions and not letting them get away without getting an answer. But I'll also spend the time back here in Ohio making sure that I listen to people like you, that I go to these places, that I see them for myself, and I have the ability with my years of government experience to take a very complicated policy and understand how it's going to apply to people in their everyday lives, because I've lived it myself.
We in the United States are way back as far as pharmaceuticals, and the pharmaceuticals prices are outrageous. Let me tell you this, if the economy is so bad, why are they going up?
And the way we have set up our healthcare system is kind of like basically trying to cure a headache by beating your head against the wall. And that's what we keep doing over and over again. Imagine in our country to be able to walk into a pharmacy and talk to a pharmacist about your symptoms, and the pharmacist to simply say, this will take care of your problem. We can't even imagine that in our country. And so the kind of reform President Obama is talking about isn't even going that far, but it's saying, let's put all of our medical records together, let's make sure that the right hand knows what the left hand is doing. President Obama is a leader with a vision. He was smart enough to let the Congress start to work out and work through these packages because he's known what gridlock there's been before. I suspect what we'll finally see will be something that's incremental, not as far as what a lot of people want to go, and there'll be some people who won't even go that far. I know when I was trying to change the voting system, I had the people on the right mad at me and I had the people on the left mad at me, and we all agreed that we needed some changes, and that's about where we stand with healthcare today.